Unfortunately, even as the COVID-19 cases rise in Guyana, there has been no news of pregnant women becoming infected, and more importantly, no record of mother-to-child transmission of the dreaded disease. Nonetheless, the Ministry of Public Health, in recognizing the impact the disease can have on this category of persons, has adjusted the process for them to access antenatal care at the various health centers. So says Dr. Temika Scott, Director of the Maternal and Child Health Unit.
As of March, clinics have been staggered to ensure that there is no full waiting room. Appointments have been rescheduled, especially if you're early in the pregnancy and you have no high risk. Then your healthcare provider may have made contact with you at some time to reschedule an appointment. Appointment times and dates are being given, and the ministry is urging that women keep those particular dates.
Scott added that the expectant mothers are required to wear masks while at the facilities. Notwithstanding the fact that the immune system's efficacy dips during pregnancy, which places prenatal women at a higher risk of contracting many transmissible illnesses, whether foodborne or respiratory, Dr. Scott explained that based on proven scientific data, pregnant women stand a similar chance of contracting the disease as women who are not pregnant.
We want to remember, however, that in pregnancy, a woman's immune system is naturally weakened. And if you have a naturally weakened immune system, it means that you're more susceptible to viruses and bacteria, correct? And this weakening of the immune system is naturally physiological because that is what helps the body not to reject the baby. And so viruses can be opportunistic. Data is still coming in, however, and from the limited studies that we have seen, they have been very good outcomes for both mother and baby.
Acknowledging the fact that 35% of the local COVID-19 cases are asymptomatic, Dr. Scott emphasized the need for both pregnant women and persons they interact with on a daily basis to take the health precautions seriously in order to keep the disease at bay.
Well, if you live in a crowded space, then you may want to ensure that all your family members are very well aware that the same measures you're taking at home, the same measures they should take whenever they go for essential services. You really don't want to have a situation where in your own home you're at risk because maybe another family member is not taking the precautions that they should be taking. Pregnant women need to clean surfaces very often. I know that depending on the stage of pregnancy, certain smells of detergents and alcohol may be repugnant to the pregnant woman. They can have somebody else clean for them.
Temika Rodney reporting for the HGP Nightly News.